Good morning. It's December 9th, and this is your daily brief in science. Here's everything you need to know. Beam Therapeutics Incorporated has revealed promising safety and efficacy data from its Beacon Phase 1/2 clinical trial for Beam 101, a treatment targeting patients with sickle cell disease who experience severe vaso-occlusive crises. This significant update was presented at the American Society of Hematology annual meeting on December 7, 2024, showcasing the potential of Beam 101 as a novel therapeutic option. The trial data from 7 patients indicated notable increases in fetal hemoglobin levels, with all participants achieving HbF levels exceeding 60%. Additionally, sickle hemoglobin levels were substantially reduced, with all patients reporting HbS levels below 40%. Follow-up periods for these patients ranged from 1 to 11 months, during which significant improvements in hemoglobin levels and disease markers were observed. Patients also experienced resolution of anemia and normalization of hemolysis markers following treatment, with no vaso-occlusive crises reported post-engraftment. Furthermore, the treatment led to rapid engraftment of neutrophils and platelets, averaging 17.1 days and 19.1 days, respectively. The safety profile of Beam 101 aligned with that of busulfan conditioning and autologous stem cell transplantation. However, it is important to note that one patient died due to respiratory failure related to the conditioning, which was determined to be unrelated to Beam 101. Data from the ESC-APE non-genotoxic conditioning program further emphasized the company's goal of enhancing treatment accessibility and minimizing complications associated with transplantation. The efficiency of cell collection for the trial was notable, requiring only 1 to 2 mobilization cycles, with an average of 1.4 cycles per patient. These findings position Beam 101 as a competitive contender in the sickle cell disease therapy market, which is valued at approximately $5 billion. As of October 28, 2024, a total of 11 patients have been dosed in the ongoing trial, indicating strong enrollment interest and momentum. Superconductivity, a phenomenon that has captivated scientists since 1911, continues to be a focal point of research and discovery. This interest began when Heike Kamerlingh-Onnes first observed resistance-free electrical flow, raising questions about how electrons can pair despite their natural repulsion. The foundational work in this field was established in 1957 by John Bardeen, Leon Cooper, and John Robert Schrieffer, whose phonon-based theory of superconductivity won them the Nobel Prize in Physics in 1972. Matthew Yankovitz, a physicist, has pointed out that superconductivity is found in various materials, suggesting multiple mechanisms for electron pairing. However, the phenomenon in higher-temperature superconductors like cuprates requires new explanations, prompting ongoing research into unconventional superconductors. Recent findings indicate that superconductivity is not limited to established theories, as physicists explore new models to better understand these phenomena. This year has seen researchers confirm superconductivity in new two-dimensional materials, including transition metal dichalcogenides, or TMDs, and identify a novel superconducting state in graphene. Notably, Jia Shan and Kin Fi Mak at Cornell University discovered a unique superconducting state in TMDs without the addition of electrons, highlighting the complex interactions within these materials. Additionally, Corey Dean's team at Columbia University observed superconductivity in TMDs after applying a 5-degree twist, aligning with previous theoretical predictions about electron behavior in moire patterns. Longju's group at MIT reported an exotic form of superconductivity in a staircase arrangement of graphene layers, showcasing the diverse mechanisms that can lead to this phenomenon. The technological implications of these discoveries are substantial, with potential applications in lossless power grids and magnetically levitating vehicles should superconductors be able to operate at higher temperatures. According to physicist Ashvin Vishwanath, 2 of these recent discoveries challenge existing theories, while the third represents an unprecedented form of superconductivity. These breakthroughs are largely attributed to advancements in materials science, particularly in the manipulation of two-dimensional materials to exhibit various electrical behaviors. A recent study has unveiled important connections between sleep patterns and chronic kidney disease risk, particularly highlighting the influence of lifestyle behaviors. Conducted with over 294,000 participants from the UK Biobank, the research focused on 5 key factors: sleep duration, chronotype, insomnia, snoring, and daytime dosing. The findings indicate that inadequate sleep duration, in conjunction with unhealthy lifestyle choices such as smoking, poor diet, and low physical activity, is independently linked to an increased risk of chronic kidney disease. To evaluate these lifestyle behaviors, researchers developed a new Healthy Lifestyle Score, or HLS, which considers smoking status, physical activity, diet, body mass index, and mental health. Mental health was identified as a vital component of the HLS, underscoring its role in managing CKD risk. The study proposes that incorporating mental health into lifestyle management strategies could enhance efforts in preventing chronic kidney disease. Notably, participants with a low HLS faced a significantly heightened CKD risk associated with poor sleep patterns, whereas those with a high HLS appeared to reduce this risk. This research emphasizes the complex interplay between sleep, lifestyle choices, and health outcomes, suggesting that modifications in lifestyle could be key in mitigating the risk of chronic kidney disease. A significant breakthrough has been made at the Large Hadron Collider, as researchers have successfully observed quantum entanglement between top quarks during high-energy proton collisions. This achievement marks a pivotal moment in particle physics, showcasing the advanced capabilities of the LHC's technology. Using the sophisticated ATLAS and CMS detectors, scientists captured results that demonstrate quantum entanglement in top quarks with notable statistical significance. This discovery highlights the critical role of innovative experimental techniques in modern physics, pushing the boundaries of our understanding. The implications of this finding are substantial, as they extend to testing the limits of the Standard Model, enhancing our understanding of dark matter, and advancing studies in quantum gravity and quantum computing. Potential applications include improving quantum computing methods and probing fundamental forces. However, the complexity of these experiments necessitates significant resources and careful interpretation of results to avoid challenging established theories. Top quarks, being the heaviest elementary particles, present unique challenges for study due to their significant mass and rapid decay. Investigating entangled top quarks may lead to the development of new theoretical models that better integrate quantum mechanics with gravitational forces. Looking to the future, quantum research at the LHC is expected to see increased collaboration between theorists and experimentalists, enhanced computational power, and expanded global partnerships to drive breakthroughs in particle physics. A new Finnish-led research initiative is addressing the species identification crisis, particularly focusing on insects. This collaborative effort involves researchers from Finland, the USA, and Canada who aim to develop a systematic workflow for identifying and describing tens of thousands of unidentified insect species. Insects are an ideal subject for this research due to their status as the most diverse group of animals and their essential role in maintaining ecosystem health. The project plans to systematically separate and classify insect species by integrating DNA barcoding with additional genetic data to confirm species boundaries. Recent findings suggest that Finland may have significantly more unknown gall midge species than the fewer than 400 currently documented, with estimates indicating that up to 1,000 new species could exist, as noted by researcher Nina Kiljunen. Globally, current estimates of total species range from a few million to tens of millions, yet only about 2 million species have been formally documented over the past 260 years. Professor Marko Mutanen from the University of Oulu emphasizes the urgency of implementing new methodologies due to the rapid loss of biodiversity. The concept of dark diversity is relevant here, referring to unknown species that already have a DNA barcode but lack formal identification or naming. Launched in September 2024, the project titled A Genomic Blueprint for the Description of Thousands of New Species is funded by the Research Council of Finland, with a budget of nearly €500,000 over 4 years. Key partner institutions in this research include the University of Guelph, the University of Pennsylvania, the University of Kentucky, and the University of Eastern Finland. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.